I'm Dr. Weiner, and this is Cellfina. And what Cellfina is Cellfina is a way to treat cellulite minimally invasively. And what cellulite is, it's these fibrous tissues that are pulling down on the fatty tissues and creating dimples. And so what we're doing here is we're going to release those fibrous tissues, those bands, and allow the skin to pop up. And then the skin becomes flat. So it's a two-step process. The first step is right now I'm numbing up the areas that I previously marked. I have my assistant, she's injecting lidocaine. It's a tumescent fluid, so it has lidocaine with epinephrine in it. It has a suction device as well, which takes care of most of the discomfort of the injection. The epinephrine causes vasoconstriction, which means the blood vessels contract. Her main problem is the buttocks area, so that's what we're treating today. Who can we treat? We can treat people that have cellulite that's related to dimples or linear bands in the leg, but we can't treat the linear aspects of the leg that are associated with the banana roll. So it's a one-time treatment actually for cellulite. It doesn't need more than one treatment. The studies have been going on for 3 years now, and it's been shown to even get better after 1 year, better after 2 years. So it's a long-term improvement of cellulite. It's a remarkably high satisfaction rate, 96% satisfaction rate at 2 years. So the feeling is that, again, it's a long-term result. The studies have only been going on for 3 years, but as we get further out, we'll even have 4-year data and 5-year data. So those studies were from the FDA trial. So what can you expect afterwards? So afterwards, you're going to have a little, obviously some of this fluid that I've injected, it's going to leak out. And that's going to be about 24 hours, at maximum 36 hours. We ask that you don't do strenuous activity for about a week. You can do upper body activity about 3 or 4 days later. And after about a week, it's okay to go jogging very lightly, not vigorously. But obviously, you want to stay away from anything that causes bleeding before this procedure so the bruising is less. You begin to see results actually about day 3 or 4. Up to this point, we haven't had any real long-term treatments for cellulite, and the treatments required multiple treatments and only lasted for months, and this is a long-lasting result, again, for the dimples associated with cellulite, particularly on the buttocks and upper thigh. We can't treat the banana rolls. How you doing, patient?
Good.
Good. Patient's doing great. We're doing great here. The whole process of this takes about 1 hour and 15 minutes. My part as far as this procedure, you're probably in the office for about 2 hours because there's some marking that goes on with this and the consents and so forth. Another thing afterwards, we recommend that you wear Spanx or tight yoga pants, and that causes a little compression. And you wear that for about a week or 2. We turn it on, we go halfway, that's a partial, and then we're done. So the numbing up part is actually much harder than the releasing part. So I get the dimple that's marked in this window here. I insert the releaser, and I go like that, and it's released. And then I remove the releaser, take off the suction, and we're done. So that's it for the procedure. As you could tell, it took about 30, 35 minutes to do from start to finish. And from this point, my nurse and PA are going to just remove some of the excess fluid so that there's hardly any left. And then we'll put some pads on. And the pads will help with the leakage. And she'll have to change those once or twice before the morning, and maybe not even after that. And just take it easy for the next couple of days. You can go back to work, that's no problem. But limit your physical activity as far as workouts until 3 days or so, and then keep your running for about a week or so. So that's it. Any more questions, give us a call at the Aesthetic Clinique, 850-622-1214, and we'll fill you in on more about Cellfina, the long-term solution to cellulite.